Hi, I'm Brian Skansen, and the goal today is to discuss an approach to the evaluation of heart murmurs in dogs and cats. We want to talk about ways we can evaluate heart murmurs in these patients to try and make sense of what we're hearing. Careful auscultation and detection of an abnormal heart sound is oftentimes the first sign of heart disease in dogs and cats. So oftentimes we're left with making a decision about the importance of a heart murmur and whether or not further diagnostic testing is necessary for that patient. Once a heart murmur is detected, it really needs to be evaluated within the context of the patient being examined. So is the animal otherwise healthy? Is there any evidence of systemic disease that could lead to a heart murmur? Determination of murmur significance really starts with trying to ascertain whether the murmur is functional or pathologic. By functional murmurs, I mean those murmurs that occur in the setting of a structurally normal heart. Functional murmurs are very common in young puppies and kittens and are often termed innocent murmurs. They also, however, can occur in adult animals due to alterations in blood viscosity, such as from stress or anemia. While it might be difficult to discern an innocent murmur from a pathologic murmur, a few generalities can be used to try and make this determination. One construct that I like to use is called the 6 S's for the evaluation of functional heart murmurs. The first S is systolic, so functional murmurs tend to only be limited to systole. They shouldn't be diastolic or continuous in duration. 2 is single. If functional murmur, there shouldn't really be any other signs related to heart disease, so the animal should have a normal rhythm. The animal should not have any history of cough or other signs related to the heart. 3 is short. So most functional murmurs are short in duration, only lasting through early to mid-systole. 4 is soft. Functional murmurs are typically lower in intensity than pathologic murmurs. They should not be louder than grade 3 out of 6. 5 is small. Functional murmurs tend to be only in one location and don't radiate widely. And 6 is sensitive. So the murmur typically gets louder with exercise or activity and is softer or absent at rest. With this in mind, then we can evaluate heart murmurs in dogs and cats within the context of the patient and the likelihood of whether or not significant heart disease is present. If the murmur fits the characteristics of the 6 S's, then functional causes are more likely. Looking for things like anemia. Is the cat hyperthyroid? Is the dog or cat very stressed? If the animal is quite young, usually less than 3 or 4 months of age, and the murmur then is likely innocent, and monitoring that patient over time can be considered. If the murmur doesn't fit the criteria of the 6 S's, then a pathologic cause is more likely and further workup may be mandatory. Should all heart murmurs undergo a comprehensive evaluation? This question is not easily answered and requires consideration of the animal's use. Breeding animals should be screened more aggressively for disease that could be passed to offspring. Animals that need to undergo general anesthesia, such as a dental procedure, may require further testing. And last, the ability, cost, and utility of available diagnostic tests, as well as the client's desire to know what the underlying cause of the heart murmur is, may play a role. Every case will have different answers to these questions, but beginning with an assessment of how likely this murmur is to be functional or pathologic is important, and then considering the top differentials for each category of murmur based upon its location and other physical findings can help to refine your interpretation of the murmur's significance. I hope you find this discussion helpful, and for more information, please go to cardiaceducationgroup.org.